Hey everyone, welcome back to Infinite Infotainment. Today, we're diving deep into a topic that's crucial for your overall health, your liver. You know I always say prevention is key, and that's especially true when it comes to this vital organ. We often don't think about our liver, but it's a powerhouse working 24/7 to filter toxins, digest food, and even help fight off infections. But here's the thing, liver disease often doesn't show symptoms in its early stages. That's why it's so important to be aware of the subtle signs that something might be off. The statistics are pretty alarming. Did you know that millions of people are living with some form of liver disease and many don't even know it? That's why we're going to cover 15 weird signs of liver damage that you definitely shouldn't ignore. We'll also be discussing natural ways to potentially reverse some of these issues and support your liver health. Remember, I'm not giving medical advice, so always consult with your doctor about any health concerns. Now let's get started. Our first sign of potential liver trouble is one you've probably heard of, jaundice. Now, jaundice itself isn't a disease, but it's a big red flag that something's up with your liver. Basically, it's when your skin and the whites of your eyes take on a yellowish tint. This yellowing happens because of a buildup in your blood of a substance called bilirubin. See, your liver is usually responsible for breaking down bilirubin, which is a byproduct of old red blood cells. But when your liver's not functioning properly, bilirubin can accumulate and seep into your tissues, causing that yellow discoloration. Mild jaundice might not seem like a big deal, but it's definitely not something to ignore. It could be a sign of a range of liver issues, from something as relatively harmless as a viral infection to something more serious like hepatitis or even liver damage. So, if you notice any yellowing of your skin or eyes, even if it's subtle, it's crucial to get checked out by a doctor. They can run tests to figure out the underlying cause and determine the best course of action. Moving on to our next weird sign of potential liver damage, itchy skin. Now, we all get itchy skin from time to time, whether it's from a bug bite, dry skin, or an allergic reaction. But if you're experiencing persistent, unexplained itching, especially if it's accompanied by other symptoms we're discussing, it could be a sign your liver's struggling. You see, when your liver isn't functioning optimally, it can have trouble filtering out bile, which is a digestive fluid produced by the liver. This bile can build up in your bloodstream and deposit in your skin, leading to intense itching. This type of itchiness is often described as unbearable and doesn't seem to have an obvious external cause. You might notice it all over your body, or it might be concentrated in specific areas. If you're experiencing persistent itching that's interfering with your daily life, don't just brush it off. Talk to your doctor to rule out any underlying liver issues. Alright, let's talk about something we all do, every single day, multiple times a day, and no, it's not scrolling through TikTok, it's peeing. Peeing is important, guys, and the color of your pee can tell you a lot about your health, especially when it comes to your liver. So what gives urine its color in the first place? Well, it all comes down to a pigment called bilirubin. Bilirubin is a yellowish substance that's produced during the breakdown of red blood cells. Your liver is responsible for processing bilirubin, getting it ready to be excreted from your body. Now, when your liver is damaged, it can't process bilirubin as efficiently. This can lead to a buildup of bilirubin in the bloodstream, which can then make its way into your urine, giving it a dark yellow, brown, or even tea-colored appearance. So, next time you go to the bathroom, take a quick glance before you flush. You never know, your pee might be trying to tell you something. Okay, so we talked about pee, now let's talk about poop. I know, not the most glamorous topic, but trust me, it's just as important as your pee when it comes to understanding your liver health. Remember that pigment bilirubin we talked about earlier? Well, after the liver processes bilirubin, it gets added to bile, a digestive fluid produced by your liver. Bile plays a crucial role in breaking down fats and helps give your poop its normal brown color. However, when the liver is damaged, it may not produce enough bile or the bile flow might be obstructed. This can lead to pale, clay-colored stools, a telltale sign of liver dysfunction. So, if you've noticed your poop looking a little pale lately, don't ignore it. It could be a sign that your liver needs some love. Alright, let's talk about abdominal pain. We've all experienced it at some point, whether it's from eating too much pizza or that dreaded stomach bug. But did you know that persistent pain in a specific area of your abdomen could be a sign of liver damage? The liver is located in the upper right quadrant of your abdomen, just below your rib cage. When the liver is inflamed or enlarged, it can put pressure on surrounding organs and tissues, causing pain in this area. The pain associated with liver damage is often described as a dull, aching pain that may worsen after eating fatty foods. It's important to pay attention to the location, duration, and intensity of your abdominal pain, as this information can help your doctor determine the underlying cause. Alright guys, let's talk about fatigue. We've all felt tired here and there, maybe after a long day or a tough workout. But if you're experiencing that bone-deep exhaustion, that feeling of being constantly drained, it might be a sign your liver is struggling. See, your liver is a powerhouse. It's working around the clock to filter toxins, produce energy, and keep your body running smoothly. When it's not functioning optimally, one of the first signs is often persistent fatigue. Now, fatigue can be a symptom of a lot of different things, from stress to poor sleep to other medical conditions. But if you're noticing this alongside other symptoms we've talked about, like jaundice or itchy skin, it's definitely worth getting your liver checked out. Moving on to another common but often overlooked sign of liver damage, nausea. We've all felt that queasy, uneasy feeling in our stomachs at some point, whether it's from a stomach bug or maybe eating something that didn't agree with us. But when nausea becomes a recurring issue, especially if it's accompanied by other symptoms like those we've discussed, it could be a sign that your liver is sending out an SOS signal. Now, just like fatigue, nausea can be caused by a variety of factors, so it's important to pay attention to your body and notice if any other symptoms are present. If you're experiencing nausea alongside jaundice, dark urine, or abdominal pain, it's crucial to consult a healthcare professional. Have you noticed your clothes fitting differently lately, even though your diet and exercise routine haven't changed much? Unexplained weight fluctuations, whether it's sudden weight loss or unexpected weight gain, can be a red flag for liver health. While many factors can contribute to weight changes, including hormonal imbalances, thyroid issues, and certain medications, it's essential to consider the possibility of liver involvement, especially if you're experiencing other symptoms we've discussed. Remember, your liver plays a vital role in metabolism, the process of converting food into energy and building blocks for your body. When the liver is damaged, it can disrupt this delicate balance, leading to unexpected weight changes. If you're concerned about sudden weight loss or gain, don't hesitate to reach out to a healthcare professional. Alright, let's talk about something that might surprise you: the connection between your liver and your brain. It's a fascinating and often overlooked relationship that can have significant impacts on your daily life. You see, when your liver isn't functioning properly, it can actually impact your cognitive function in ways you might not expect. We're talking about things like brain fog, difficulty concentrating, and even memory problems. These issues can make it hard to get through your day-to-day tasks. Now, you might be thinking, my brain? Really? How can my liver affect my brain? But trust me on this one. The connection is real, and it's important to understand. The liver plays a crucial role in filtering toxins from the blood. It's like the body's natural detoxifier. When it's damaged, those toxins can build up and even reach the brain, causing a range of cognitive issues. These toxins interfere with the brain's normal processes, making it harder for you to think clearly and function effectively. This can lead to that feeling of mental sluggishness or cloudiness that we call brain fog. It's a frustrating experience that can affect your productivity and quality of life. It's like this. Imagine your brain is trying to operate in a smoky room. The smoke represents the toxins that your liver isn't filtering out. It's going to be harder to think straight, right? Everything becomes more challenging and less clear. That's kind of what happens when your liver isn't filtering toxins effectively. Your brain struggles to function in the way it should. So if you've been experiencing unexplained cognitive issues like trouble focusing or remembering things, it's definitely worth considering your liver health. It might be the missing piece of the puzzle. Of course, brain fog can be caused by a lot of things, from stress to lack of sleep. It's important to consider all potential factors. But if you're noticing other symptoms on this list, along with cognitive changes, such as fatigue or digestive issues, it's a good idea to talk to your doctor and get your liver checked. Taking care of your liver might just help clear the fog from your mind. Have you ever noticed swelling in your legs or ankles, especially after standing for a long time? This is called edema, and while it can be caused by a number of things, it can also be a sign of liver damage. You see, when your liver isn't functioning properly, it can disrupt the balance of fluids in your body. This can lead to fluid retention, which often shows up as swelling in the lower extremities, like your legs and ankles. Now, how does this happen? Well, a damaged liver can lead to a decrease in a protein called albumin. Albumin helps keep fluid in your bloodstream. When albumin levels are low, fluid can leak out of your blood vessels and into the surrounding tissues, causing swelling. It's important to remember that edema can have many causes, so it's not always a sign of liver problems. But if you're experiencing persistent swelling, especially if it's accompanied by other symptoms on this list, it's definitely worth getting checked out by a doctor. All right, let's talk about another unexpected sign of liver damage: bruising easily. You might be wondering, what does my liver have to do with bruises? Well, it all comes down to the liver's role in blood clotting. The liver is responsible for producing proteins that are essential for blood clotting. These proteins help to stop bleeding when you get injured. But when your liver is damaged, it can't produce these proteins as effectively, which can lead to easy bruising or bleeding. Think of it like this. Imagine your blood vessels are like a network of pipes. When a pipe gets damaged, you need something to plug the hole and stop the leak, right? That's what these clotting proteins do. But if your liver isn't producing enough of them, it's like trying to fix a leaky pipe with a flimsy bandage. It's not going to be very effective. So if you find yourself bruising or bleeding more easily than usual, especially if you haven't had any recent injuries, it's important to talk to your doctor. Now let's move on to a symptom that might seem subtle at first, but can have a big impact on your health: loss of appetite. You know that feeling when you're really excited for a delicious meal, but then you take a bite, and it's just, Well, imagine feeling that way all the time. That's what it's like to experience a persistent loss of appetite, and it can be a warning sign from your liver. When your liver isn't functioning properly, it can disrupt your body's natural digestive processes. This disruption can lead to feelings of fullness, even when you haven't eaten much, or it can make food seem completely unappetizing. If you're experiencing a prolonged loss of appetite, especially if it's accompanied by other symptoms on our list, it's crucial to consult with a healthcare professional. They can help determine the underlying cause and recommend the best course of action for you. All right, let's dive into another peculiar sign of potential liver trouble: spider angiomas. Now, before you imagine actual spiders setting up camp on your skin, let me clarify. Spider angiomas are small, red, spider-like blood vessels that can appear on your skin. They get their name from their appearance, with a central red dot and thin blood vessels radiating outwards, resembling spider legs. While they can appear anywhere on the body, spider angiomas are commonly found on the face, neck, chest, and hands. They're usually harmless and painless, but they can be a visible indicator of underlying health issues, including liver damage. So, how are spider angiomas linked to your liver? Well, a healthy liver plays a crucial role in filtering out waste products from your blood. When your liver isn't functioning optimally, these waste products can build up, potentially leading to the formation of spider angiomas. All right, guys, let's talk about something nobody wants to discuss: bad breath. It's one of those things that can make social interactions really awkward and uncomfortable. We've all been there, right? That moment when you realize your breath isn't as fresh as you'd like it to be. But what if I told you that a persistent, musty odor, almost like ammonia, could be a sign of liver trouble? Yes, you heard that right. It's not as crazy as it sounds. Our bodies have a way of signaling when something is wrong, and bad breath can be one of those signals. You see, when your liver is struggling, it can't filter toxins properly. This is crucial because the liver is responsible for detoxifying our blood. These toxins can build up in your bloodstream and actually come out in your breath. Imagine that. Your breath could be telling you something important about your internal health, not the kind of minty freshness you're going for. It's more like a warning signal that something might be off. Now, before you panic and start overdosing on mouthwash, remember that bad breath alone doesn't automatically mean liver damage. There are many reasons for bad breath. It could be a simple case of needing to brush your teeth more often or see your dentist about gum disease. Oral hygiene plays a huge role in keeping your breath fresh. But if you're noticing a persistent, unusual odor along with some of the other symptoms we've talked about, it's definitely worth getting checked out by a doctor. Don't ignore these signs. Think about it. Your liver is like the body's main filter, working tirelessly to remove all the junk that enters your system. It's a vital organ that needs to be in top shape. When it's not functioning at its best, those toxins can really start to stink things up. Literally, your body is trying to tell you something. So if you're concerned about your liver health, don't just mask the problem with mints and gum. These are temporary fixes that won't address the underlying issue. Get to the root cause and see a healthcare professional. It's always better to be safe and get a proper diagnosis. Your health is worth it. Have you ever noticed your palms looking unusually red, like they're flushed even when you're not hot or flustered? While it might seem harmless, this redness, also known as palmar erythema, could be a sign of liver issues. Now I know what you're thinking. My hands are always warm, but we're talking about a distinct redness, often concentrated on the outer edges of your palms. Here's the deal. When your liver isn't functioning correctly, it can disrupt the balance of hormones in your body. This hormonal imbalance can lead to widened blood vessels, including those in your hands, causing that red appearance. It's like your body is sending you a signal, a red flag if you will, that something might be off with your liver. Now, just like with bad breath, red palms alone don't automatically mean you have liver damage. Pregnancy, certain medications, and even excessive alcohol consumption can also cause palmar erythema. But, if you're noticing this symptom along with other signs of liver trouble, it's important to take it seriously and talk to your doctor. We've covered a lot of ground today, from jaundice and itchy skin to bad breath and red palms. It's important to remember that these are just potential warning signs, and experiencing one or two of them doesn't necessarily mean you have liver damage. These symptoms can be caused by a variety of factors, and sometimes they might be temporary or related to other health issues. However, if you're noticing several of these symptoms, especially if they're persistent or worsening, it's crucial to consult with your doctor. Early diagnosis can make a significant difference in managing any potential liver issues and preventing further complications. They can help determine the underlying cause and recommend appropriate treatment options. Your doctor might suggest lifestyle changes, medications, or further tests to get a clearer picture of your liver health. Now, the good news is that there are many natural ways to support your liver health and potentially reverse some of the damage. Eating a balanced diet rich in fruits, vegetables, and whole grains is essential. These foods are packed with vitamins, minerals, and antioxidants that help your liver perform its vital functions. These foods provide your liver with the nutrients it needs to function optimally. Incorporating a variety of colorful fruits and vegetables can ensure you're getting a wide range of nutrients. Additionally, staying hydrated by drinking plenty of water throughout the day is crucial for flushing out toxins and supporting liver detoxification. Water helps your liver filter out waste products and keeps your body functioning smoothly. Regular exercise is another powerful tool for improving liver health. It helps with weight management, reduces inflammation, and improves insulin sensitivity, all of which benefit your liver. Aim for at least 30 minutes of moderate exercise most days of the week to keep your liver in top shape. Incorporating stress-reducing activities like yoga, meditation, or spending time in nature can also have a positive impact on your liver health. Chronic stress can negatively affect your liver, so finding ways to relax and unwind is important. Remember, your liver is a resilient organ, and with the right care and support, it can often repair itself. If you're concerned about your liver health, talk to your doctor. They can provide personalized guidance and help you develop a plan to optimize your liver function and overall well-being. They can provide personalized guidance and help you develop a plan to optimize your liver function and overall well-being. This might include dietary recommendations, exercise plans, and other lifestyle changes tailored to your specific needs. Early detection and proactive lifestyle changes can make a world of difference when it comes to maintaining a healthy liver for years to come. By taking small, consistent steps, you can support your liver and improve your overall health. So, take charge of your health, listen to your body, and don't hesitate to seek medical advice when needed. Your liver plays a crucial role in your overall well-being, and taking care of it can lead to a healthier, happier life.